Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. Today we will discuss the Ayurvedic herbal treatment of a disease known as aplastic anemia. Now we all know anemia suggests that there is less blood or less hemoglobin or red RBCs. But aplastic anemia is a disease in which most of the time all the cells in the blood, the red blood cells, the white blood cells as well as the platelets, all these can reduce and come down drastically. What happens is the bone marrow gets suppressed and production of all these cells is either stopped completely or goes down drastically. There can be various reasons for this, exposure to some toxic drugs or some toxic chemicals or chronic infection. These sort of things can suppress the bone marrow. Now this is a condition where the body's immunity comes down drastically, or the immune system may be altered and may start hurting the body instead of helping it. So in this condition, the patient has complete anemia, low hemoglobin, low RBCs, possibly low WBC as well as platelets, and automatically the symptoms then come in the form of weakness, fatigue, low grade fever, and repeated infections, tiredness, etc. This disease needs to be treated very well, because in the long run it can prove to be fatal, because it can invite a lot of infections. The modern treatment of this disease involves several drugs which are very costly, which have large number of side effects, and not tolerated by many patients, and most patients do not respond well to these treatments. So Ayurvedic herbal treatment is very useful in the treatment of aplastic anemia, and oral medications are given to help stimulate the bone marrow to start producing more cells. Now this gradually works, and the production of RBCs, WBCs and platelets gradually starts coming to normal. Normally about 8 to 10 months treatment is required to bring about these changes. Now there are some patients who do not respond only to oral medication. In these cases, Ayurvedic Panchakarma treatment modalities need to be added to the oral medication. The most common one is Basti, medicated enema, which helps to bring back the platelet, RBC and WBC counts to normal very quickly. So a combination of these treatments needs to be given, and this helps to bring the patient in remission. And then once the patient has normal counts, RBC, WBC and platelets, then the medicines can be gradually tapered off to ensure that the patient doesn't relapse or doesn't have the same symptoms happening again. As I said, about 8 to 10 months treatment is sufficient, and most patients are going to complete remission with normal counts. After that, the medicine can be gradually tapered, and then the patient can be monitored for some time to see if there is a relapse. Or needless to say, the causes which have caused this condition need to be removed completely, otherwise the patient may relapse. So friends, this is a short description of Ayurvedic herbal treatment of aplastic anemia. Let's meet in the next video. Goodbye.